participants from the Tour de France 47 to 2012. I think that's really quite interesting topic. Please, if you have questions afterwards, state your name, state the media you come from, and please wait on the mic, otherwise we cannot record things appropriately. Thank you so much, and please, Dr. Jouvin.
Thank you for introducing. Thank you to be here. Hello, everybody. So I'm going to talk to you about the mortality of the participants in the Tour de France. I have some disclosure to declare. And as you know, it's always recognized that a moderate exercise is good for health. However, we do not know until which level we have to advise our patients, but also the general population to go. And generally, people are afraid to do very high-level exercise. So we wanted to address this issue. And also, it's known that in a very high level, there is a danger of over-exercising, there is a danger of accident, there is a danger of doping, and you have seen on the media, you are the media, and we have seen in the Tour de France several accidents, and Tour de France is probably the most difficult race in the world. It's compared to running a marathon every day for a week, for nearly 3 weeks, and climbing 3 Everest. So that's a very difficult race, and so our goal was to look for the mortality of the Tour de France participants. If they died earlier, if they increased their mortality, if they died from sudden death, that was the goal. Also, you know that the Tour de France is always a big event with a big failure. It's many controversies about doping, about danger, about accidents. And so we looked for the mortality of the French participants. Why only the French? Because we wanted to have every one case. We did not want to miss even one case, which is very important in the methods of our approach. And so what we did, we have every case. We did not miss one. So we had the possibility to look at the mortality of those who participate to the Tour de France from 47 to now, and compare their mortality to the mortality of the male population, same age, in France. And so exactly what we did, we have around 18 participations, and maybe there is something. And we looked for the. Sorry, it's going on the wrong. Okay, and so we looked for the death, and we observed 200 deaths. But what we observed more was a real and substantially decrease in the mortality rate, which is a 40% decrease in the mortality rate compared to the general population, which is huge. And we were able to look for the increased longevity only for the first years, obviously, and we observed that the participants to the Tour de France live longer, 6 years longer than the general population. And you see here our results according to class age and according to periods. We wanted to see if there was, we observed the same results according to every class of age, and that's exactly what we observed, except for the youngest one. And also we wanted to observe if our results were consistent over the periods, the 3 periods of time. And that's exactly what we observed. You see here a decrease in mortality rate. And also, we looked for the causes of death, which is very important, and we have the causes of death for everyone. And you see that the decrease in mortality rate is observed for every cause of death, for cardiovascular death, but also for cancer death, for every cause of death, except for traumatic causes, which is quite logical because they fall on the road or they have crash accident. But otherwise, the results were very consistent. So, our conclusions are that there is a substantially and significantly lower mortality in French participants in the Tour de France compared to the general population. The extent to which it can be applied to other populations, we don't know, but we presume that we could observe the same for other nationalities. And our results do not allow us to go further in the explanation about the positive effect, the balance between the positive effect of very high-level sport and the negative effects. So in the positive effect, you have first that there is obviously a selection of very special people, very athletes, very good level, very high-level athletes. So that's a genetic selection. And also you have the fact that they are doing sport regularly before during the competition, but also in the years following their competition time. On the negative effect, you have these questions about over-exercising, you have also accidents, you have also doping. And so when we look at the positive effect and the negative effect, what we can tell you is that, okay, the mortality is lower. So in summary, we have to deliver the following message. It's these very high-level people, they live longer, they have a lower mortality, and if we want to look at the message we want to deliver to the general population, then, you know, we are, as medical doctors, we are usually restricting the sport, you know, be careful, look, go to see your doctor, it's very dangerous to exert yourself, only walk slowly, you know, and probably it's wrong. This message is a wrong message that we address to the general population, and probably we have to address that, and we encourage the people to exert themselves to do sport, but at a good level. So thank you for your attention.
Thank you so much. So we have a first question here from the first row. Please state your name and media and nationality you come from. Where's the mic here, please? First one. Thank you.
Bruce Jansen from Cardiology News. I'd be interested in any data or your clinical impressions as to the prevalence of atrial fibrillation in this group.
Good.
Yeah, no, that was not the purpose of our study. We will look at this later, so maybe in some years we'll give you the answer. We presume that it should be higher.
Further questions? Yes, please. Another. Where is she?
Oh, thank you.
Thank you.
Ed Tussman with MedPage Today. Did you correct for smoking in the general population versus smoking in on the cyclists, and also did you look as to whether these elite athletes continue to exercise after they stop their professional careers?
Yeah, so there are two questions in your question. The first one is the risk factors in the general population compared to the risk factors in these very highly selected athletes. So we were not able to adjust because we only looked for mortality. So that's the first question. The second question is that it's true, yes, that usually they have a much better behavior even after the competition time compared with the general population.
Yes, sir. Yes, please.
You talk about the benefits and the effectiveness of exercise, but how do you sort that out?
So just, can you speak louder, please?
Can you hear me? You talk about the benefits of that you observed as an effective exercise, but how do you sort that out from any genetic predisposition or anything? You know, just generally healthier people who are more likely to do this.
Yeah, obviously, and this is probably the first reason of our results is that those people who are participating to this very high-level competition, they are highly selected. So obviously you're right, and that's probably the main explanation, and that's the reason why I say, okay, I can no go further in the explanation. I can only assess the balance.
Well, but you were making exercise recommendations.
Yes. Yes, because in one way, if you ask, okay, if there was a real danger of doing very high-level exercise, then we should have observed, and I have to tell you, that's what we expected, a slightly increased mortality. We expected to observe exactly the opposite. And so that's not what we observed. So that means that, okay, the positive effects are stronger than the negative effect. And then afterwards, I cannot split between the positive effect and the negative effect. I cannot go further in explanation. That's true.
So this is a last question, please.
Yeah, Roger Sogel, MedPage Today. Can you just address, was 6 years a surprise? You know, when you started the study and you thought, well, I wonder what this will be. Was 6 years a surprise? And can you sort of repeat what your view is after looking at this data in terms of what you think physicians should say to their patients about exercise?
Yeah. No, the point is that, you know, when we are delivering messages, we are delivering messages for, as medical doctor, for patients who maybe have an increased risk to die suddenly during sport. So we are usually delivering messages of be careful, go to see your doctor, do many examinations. And we have to be careful because we are also delivering the message for the general population. And then the general population is probably afraid of doing this sport at a better level than walking slowly. And so we have to control our speech and our message in terms of public health. So that's why I'm happy to deliver this talk, because you know that there have been many articles saying, okay, you know, when you run a marathon, you increase slightly your troponin, you increase slightly, you damage slightly your kidneys, the heart, the brain, and so that's dangerous, don't do marathon. And so that this general message do harm for the general population in terms of public health.
So
So
thank
that
you so
was the
much.
message.
I'm sorry to say we have to go on. Thank you very much for this presentation and interesting.